We are going to discuss superficial fascia of the abdomen. It provides a cushion effect and passageway for a lot of nerves, arteries, vessels, etc. It has two layers: superficial fatty layer, camper fascia, and the deep membranous layer, scarpa fascia. Scarpa fascia. Scarpa fascia extends as in lower limb. It continues 1.25 cm below the inguinal ligament as fascia lata. In penis as penile fascia. In peritoneal or pelvic region as Cooley's fascia. In scrotum, it is replaced by the dartos muscle. Fascia lata, penile fascia, Cooley's fascia, dartos muscle. Dartos muscle is the muscle present in superficial layer. The superficial fascia contains extremely variable amount of fat in lower abdomen that basically accumulates in lower area of the abdomen after puberty. Cutaneous nerves, cutaneous arteries, and cutaneous veins. Cutaneous nerves. As we roughly draw the abdomen, here the costal margin, xiphoid process, superficial inguinal ring, inguinal ligament, and linea alba, linea semilunaris. It is supplied by nerves from T7 to T12. In the middle, on lateral side, it is supplied by T10 and T11 by iliohypogastric nerve that is part of the L1 and ilioinguinal nerve L1 that passes through the superficial inguinal ring. T7 to T11 are the intercostal nerves and T12 is the subcostal nerve. T7 to T12 nerves that supply the middle of anterior abdominal wall passes between the internal intercostal and transversus abdominis, then pierce the posterior lamina of oblique aponeurosis, enter rectus sheath, pierce rectus abdominis muscle, pierce anterior wall of rectus sheath, divide into lateral and medial branches, and then supply the abdominal skin. Lateral cutaneous nerves that are T10 and T11. Each nerve passes or pierces the external intercostal and divides into large anterior branch and two small posterior branches. Large anterior branch basically supplies the external oblique, and two small posterior branches emerge between lower digitations of the external oblique and supply the abdominal skin. Cutaneous arteries. Anterior midline supply, lateral supply, and lower abdominal supply. There are three sets. Anterior midline supply, two arteries, superior and inferior epigastric arteries. Superior epigastric is branch of the internal thoracic artery and inferior epigastric is branch of the external iliac artery. Lateral supply is by the posterior intercostal arteries. And lower area of abdomen is supplied by superficial epigastric artery, superficial external pudendal artery, and superficial circumflex iliac artery. All three are branches of femoral artery, and superficial circumflex iliac artery supply the area or skin below the inguinal ligament. Cutaneous veins. They accompany the arteries. Superficial inguinal veins drain into the great saphenous vein. Cutaneous veins connect with the deep veins that connect with the portal system that further connects with the cable system. Lymphatics. Here again the concept of watershed line, transverse imaginary line through the umbilicus on the anterior abdominal wall. Upper part of abdomen from this line is drained by axillary lymph nodes, below this line by the superficial inguinal lymph nodes, and here are the clinicals: superior vena cava blockage and inferior vena cava blockage.